Hi, I'm Dr. Nick Campitelli. Thanks for stopping by my YouTube channel. In today's video, we're talking about ganglion cysts. We'll talk about what a ganglion cyst is, what are some things that you could do at home to treat them, and most importantly, when it's time to call your doctor. So let's get started with this video about ganglion cysts. So what is a ganglion cyst? It's an outpouching or a growth in your foot, or it can be in your ankle, hands, in fact anywhere on your body where you have a joint or a tendon and we have that area fill up with fluid. So the joint capsule can expand and you'll see a collection of fluid there, and that's the ganglion cyst. The same thing can happen over a tendinous structure, such as this tendon in your hand, or there's tendons in your foot that run over the top of your foot. There's a sheath over this tendon and it can fill up with fluid. And it'll almost balloon out, just like a balloon that if you're twisting it and you see that balloon outpouch, that's what happens to this tendon sheath. And it fills up with fluid that's called synovial fluid. They're very benign and they're nothing to worry about unless they cause pain. So what can you do for this at home if it becomes painful? Well, the first thing that I would recommend doing is putting some ice on it to calm the area down. You can take anti-inflammatories if it's okay with your body. Another option is to just wear wider fitting shoes. That's really about it. There's not much you can do for this growth, so typically you'd have to call your doctor. So what do we do with ganglion cysts? Well, the first thing that we can do in the office is simple. We can try to drain the fluid out of that. It's a simple procedure that's painless. We'll numb the area surrounding the ganglion cyst and we'll use a small needle to draw fluid out. And we'll inject a steroid so that we can try to stop the cells from producing synovial fluid that line this sac that I had discussed. Surgically speaking, it's an outpatient procedure where you'll go to an outpatient facility. A small incision is made over the ganglion cyst. It's excised and sutured back together, and the recovery time is usually anywhere from 7 to 14 days. Have you ever heard of someone saying you can rupture a ganglion cyst with the Bible? You actually can, but I don't recommend doing that because it could be painful. Sometimes in the office though, we'll put firm pressure on that cyst and it can rupture and the fluid will just disperse into your body. It's very safe, although I don't recommend trying this at home because it can be painful. Well, that's it for ganglion cysts. If you have any questions, please make sure to leave them in the comments section below. You can check out some of these videos that I also have posted on my channel. And if you have any questions about foot or ankle problems, drop them in the comments section below and I'll try to answer them or record a video about them in the future. Thanks for stopping by.